Hi, my name is Gabrielle Green. I'm registered at South Alabama and I'm going to be doing a cardiac assessment if that's okay with you. So first I'm going to raise the workstation and I'm going to extend the table. So first I'm going to inspect for your apical impulse, which I do not see, but it will be located at the 4th and 5th intercostal space on the midclavicular line on the left side of the sternum. Now I'm going to look for any lifts or heaves, which I do not see. So now I'm going to state that the regular heart rate is 60 to 100 beats per minute, which is more regular than irregular. And the base of the heart is located at the 2nd intercostal space on the left side of the sternum, and the apex of the heart is located at the 4th or 5th intercostal space on the midclavicular line on the left side of the heart. So now I'm going to begin palpation, and I am going to palpate your apical impulse, which is located on the 4th or 5th intercostal space on the midclavicular line on the left side. Okay, I do feel the apical impulse. Now we're going to begin osculation. So I'm going to be osculating the heart and the valve signs, and the location of those is the aortic valve is heard at the 2nd intercostal space on the right side of the sternum. The pulmonic valve is heard at the 2nd intercostal space on the left side of the sternal border. The tricuspid valve is heard on the 4th and 5th intercostal space on the left side of the sternum. And the mitral valve is heard on the 4th and 5th intercostal space, midclavicular line, on the left side of the heart. So now I am going to listen to your chest sounds with the bell and the diaphragm. Okay. Okay, so S1 and S2 was clear. There were no extra heart sounds or murmurs. So now I'm going to explain the osculatory relationship between S1 and S2. S1 being love and S2 being dove. S1 is the beginning of systole, S2 is the beginning of diastole. S1 is heard best at the apex, S2 is best heard at the base. S1 is the closure of the AV valves, which is mitral and tricuspid, and S2 is the closure of the sinusoid valves, which is aortic and pulmonic. So now I am going to check for pulse deficit, and I am going to check in the carotid, and I'm going to ask you to turn that way as I listen at the apical impulse. So they both were the same. There was no pulse deficit. Now I'm going to listen for any carotid bruits. And I'm going to ask you to look that way and take a deep breath and exhale, then hold. Okay, now you can breathe. Now look this way. Take a deep breath, exhale, then hold. Okay, now you can breathe. There were no bruits noted. Now I am going to palpate the pulse. First, I'm going to check in the carotid. Okay, now you can check this way. Now I'm going to check in the brachial and in the radial. And now I am going to check the dorsalis pulse in the feet. And now I'm going to check your legs for edema. Okay, so the pulse in dorsalis was 2+, and it was equal bilateral, and there was no signs of edema. And now I am going to check your hands and fingers for perfusion, and the hands are convex in pink and going to press down on the nail bed, and the capillary buildup is less than 3 seconds. So now I'm going to ask you to put your fingers in a diamond, which is less than 160 degrees. So there is no clubbing, and that is the end of this cardiac assessment.